So, I'll start by asking you the questions one by one. So, could you start off by describing your specialty and what your day-to-day practice entails?
So hi, I'm Dr. Neharika. I'm from Agra, the city of Taj Mahal, if you all know. So I'm an obstetrician and an infertility specialist. And now I'm starting to learn laparoscopy. So you know that medicine is always to keep updating ourselves and learning new things. So what my day-to-day practice is, I'm also a doctor plus a mother of 2 toddlers. So you can understand my day-to-day practice. It's a chaos. And plus obstetrics is a difficult branch, so you keep getting a lot of emergencies. But apart from that, my practice begins at 9 o'clock and I end it by 6 o'clock if there are no emergencies. So mornings are mostly my OT days or an operation theater days, so early mornings from 9 to 11, and then the rest is like general OPD.
Okay. I have to say, it's like so much credit goes to you for being a physician on its own is so difficult, and then you're a mother of 2. Like
Yes.
honestly, it's just a hats off. Like it's honestly incredible. Second is, so what was your journey to becoming a physician like? And here you can talk about your education, your training, any aspects that highlight your journey.
Journey has been good. It was difficult. Indian practice is very difficult for, especially for doctors. It's actually long working hours, long duties. So I did my undergraduation for 5 years, which is called as an MBBS, which is like a normal general practitioner or a GP. Then I did my post graduation in obstetrics and gynae, which was for 3 years. Then after that, I did my training in ultrasound and infertility for 1 year. So that was my like 9 years of studying. Then I started my practice and now I keep updating with small fellowship courses. I went to Germany to do a diploma in reproductive medicine for 3 months. Then I've also studied with under Professor Nickloides, if you know, in London. He's a fetal medicine specialist. So I did a course with him also for 2 months. So we keep doing, updating ourselves, but it's been a good journey.
That's lovely to hear. It's very nice. Like from all the doctors I've spoken to, everyone always says the hard work really pays off at the end. It's such a long journey, but when you do your job day to day, it's all worth it at the end.
Yes.
So next is, medicine has many specialties. It's a wide discipline. Why did you choose to pick being an obstetrician?
That's easy for me. So I come from a family of obstetricians, a family of doctors. I'm the 5th generation of doctors in my family. So both my parents are OBGYNs, both my grandparents were OBGYNs. So it actually, if you say it's in my genes and in my blood, I've been, brought up watching babies coming in this world. And somehow I really enjoyed that phase, and learning from my parents was a different experience. And, when I was deciding my specialty, I realized that I should take that advantage, of having a strong backup with me. And that's why maybe I got into obstetrics and gynecology.
That's incredible. 5th generation. For me, like I wish to be a doctor in the future. For me, it's the complete opposite. I'll end up being the first in my family. So it's interesting to hear from an alternate perspective. I come from a family of engineers. Everyone is an engineer. So it's nice to hear. It's nice to hear like sort of a generational story as well. Next is, what are some factors that medical students who are doing their studies should consider when they pick which area to specialize in?
A lot of people ask me this question, and I would always say that you should always choose what you love. If I did not like OBGYN, I would have never settled in this, even if my parents are OBGYN, because any medical profession is very tough, no matter which specialty you are in. So you have to really like it to, be successful. So whatever you want to do, because you will get that phase where you will experience different specialties, like an internship in different departments, and you'll understand that this specialty is, makes me happier, and just go for it. That's all what I would like to say.
So you say interest is key. You have to like it to be
definitely.
like continue. Absolutely. So next is, you are very passionate about being an OBGYN. It's very lovely to see. But what is one specialty that you would never consider becoming a physician?
I would never do proctoscopy. It's but okay, apart from that, I am really scared of dentist, and I don't think I can ever be a dentist. So that was a second thing. I would never consider being one, because I'm myself very, very scared of going to a dentist.
Then the interest factor you mentioned about comes back in. You would never enjoy going yourself, so you would never imagine yourself doing it on an everyday basis.
Yes, definitely.
So since your education in India, you gave the NEET entrance exam, which is the one that most medical students opt for who study here.
When I was when I was studying, we did not have NEET exams. It came after I had got into post graduation. So a lot of my students are giving NEET exams. So yeah, it came just after. Maybe I was in my second year then.
So what was your process of getting out of high school and getting into studying medicine?
Medicine is tough, and there are no shortcuts. If you think that you will do it because of just reading those 5-year questions and just finishing it off early, it will never happen. You have to be very, very thorough. And I always say that you have to make a proper plan. So you have to know that I want to get into medicine from your high school itself, because that's where your preparation starts. You have to start it from your, like from India, you have to start from your 11th standard. Most of our students start taking classes from 11th standard onwards to prepare for medical entrance, and that's how those 2 to 3 years actually of hard work goes in clearing NEET exams. It's a tough exam, it's not very easy, and a lot also depends on the luck, which I would say. So it's hard work and luck, but if you make a proper plan, you will definitely clear it. And I don't think you should be discouraged if you've not cleared it in the first go, because a lot of people give that exam. So just keep trying. The second one will be better.
Absolutely. Next is, so when you are getting into the process of picking your specialties in the more later years of being a physician, there's a lot of importance that's placed on being involved in some type of research or shadowing certain doctors. How do you think that impacts how strong of a candidate you make in the future?
I always propagate research and shadowing. So for viewers who are watching us, maybe I'll just let them know that shadowing is actually a kind of a smaller research on a smaller scale. It's called a qualitative research, where the observer itself actually does that research. And unless and until you're not doing research or not reading journals, I don't think your practice is very, very successful, because research and shadowing is something which will help you in update and building up your knowledge. It also actually helps us in felicitating any new learning, any new invention which is coming up, and it definitely builds up your credibility. So I really propagate research and shadowing. It's very important.
I think the more of a holistic application you have with multiple, like you're doing well in your courses, you're doing research, you're doing shadowing, you're reading up more, just makes you a better candidate for a position. Next is, I know this is like a question you might have been asked a lot, but it's unavoidable in the times we're in. How has COVID-19 affected your day-to-day practice?
That COVID was a tough phase. The last 2 years were difficult, and yes, it did affect our practice. We were not getting, the routine OPDs were getting stopped, and patients were coming actually reporting very late. So they were coming with all sorts of complications because they were not getting their regular checkups. Plus, the expenditure which happened in protecting ourselves and protecting our staff. Frequent sanitization, keep changing your mask, wearing those PPE kits. It was difficult. Plus the mental breakdown. It's not, as doctors we have to be very strong mentally. Plus we have to be strong for people surrounding us. Especially my staff. They were all going through a tough phase, and 14 of my staff out of 60 got COVID. So it was very, very tough. So, but yeah, I think because we were very strong as a team, it made us pass through that phase. So I always tell people, you can only be successful if you have good help at home and good team at work. So those two things are very, very important.
What I would just like, I guess, from behalf of everyone who's watching, everyone in my family around me, say a huge thank you for the work that you do. It's absolutely incredible how in this time, especially for you, you're a mother of young kids, it's huge, like a sort of moral dilemma.
I used to, wear 2 PP kits, and I used to, have a bath before entering my house. So, I'll just finish my case, have a bath, sanitize myself, then go meet my kids. It was a tough phase.
It's such a moral dilemma of like, I'm trying to work to save my patients, but also I have this family at home whom I need to take care of. It's absolutely incredible what all physicians, not just doctors, nurses, everyone who works in healthcare has
even
done.
all the security people, housekeeping people, all those, everybody worked through those difficult times.
So the next question is, there's a common stereotype of doctors not being able to have a good work-life balance. So how do you maintain a work-life balance, especially as a mother?
I really enjoy my life. If you see my schedule, it's jam-packed. I can't even tell you, like, if you ask me, give me a 1 minute of your time for this day, it's fully planned. So, to enjoy that work-life balance, I think you have to have that OCD of planning. Unless you don't plan your days, you can't plan your work-life balance, especially as a mother. So I give equal priorities to my family and my work. I'm not a person, who will cut down my priorities. If I know that Sunday is for my children, then it is for my children. When you are a doctor, I always tell people that make a team around you so that all of you can actually give those work-life balance accordingly. So if you are a team of 2 or 3 doctors, you can actually give equal time and balance your life better.
Okay. I think that's so important because since medicine is such a tough profession, burnout is so much easier. You need to give time outside of work to yourself, to the people around.
Especially, burnout for females is more difficult, because we go through a phase where we have to look after the family itself. From, just small things like grocery shopping, cleaning the house. Every responsibility in India actually comes on the female. Even the kids, if you're talking about, if homework has to be done, it'll be the mother who has to get it done. Right. So somehow, especially tough for female doctors, I would say. It's much tougher.
Next is, so as an OBGYN, what is the most common A, procedure, and then B, like say, medical condition that you encounter in your day-to-day practice?
So I'm an OBGYN, so I deal with pregnant patients most commonly. So most common vaginal deliveries and cesarean sections are the commonest procedures which I'm doing. And of course, we do get a lot of cases for abortions and, high-risk pregnancies. I do practice infertility also in the evenings. So my evening OPD is infertility OPD, where I do plan follicle monitoring, intrauterine inseminations, and, IVF. So I divide my time accordingly. And yes, I do maximum of my OPD is for pregnant patients.
Okay. Thing that you encounter. And then the final question I'd like to ask, sort of to sum everything up, what is your advice to students who wish to go into medicine, as well as those who are currently in the process of becoming doctors?
So my advice would actually be that, yes, it is a lot of hard work, and you might have to give up a lot of your time for those extracurricular things which you would like to do. But that hard work really comes back to you in little things. When I did my first cesarean section, which was around 12 years back, a baby girl was born, and that baby girl was named after me. So you can imagine, she's also called Neharika. And that was my first time I felt, oh my God, that 12 years of studying has really paid off. And now people come to you, and I have delivered babies who are now in school and going, and mothers will come with their results. This girl was born by you, and she's doing very well in school. And those little things you will not get in any other profession. So I think just give it all and love your profession, and that love will really come back to you.
Absolutely. I think the saying is really true. Being a doctor is the most noble profession at the end of the day. I would like to extend a huge thank you for giving your time. I know we had a little bit of back and forth with scheduling, but it was really nice to speak to you. I'll end the recording if you
I
could
had
just hang
actually I
back.
got dengue.
Oh, okay. I hope you're
So
doing
that's
better
why
now.
I was very sick. Yeah, I'm better now.
End the recording if you could hang back for 1 second.